Good morning. I'm gonna be your nurse today. My name is Michelle. I'm gonna wash my hands. I'm gonna close the curtain for privacy. And can I ask for your name and date of birth? Okay, I'm gonna check your wristband just to double check. So I'm gonna move any safety concerns out of the way. And then I'm going to explain the procedure. So today I'm gonna be doing a pediatric assessment. Is that okay with you? Perfect. So I'm gonna start off with the general appearance. So the child seems clean and well nourished. They seem to have a good mood and they are verbal. I'm going to assess the age developmental milestone, which is appropriate. I could test this by putting a toy in front of them and seeing how they react to that toy and how they play with it to see if it lines up with the milestone that they're supposed to be at for their age. And then I would assess the nutritional status. So the client seems like their body height and weight is appropriate for their age. Next, I'm going to assess the vital signs. So I'm going to listen to the apical pulse, and I would listen to that for 30 seconds if it's regular, and if it's irregular, I'd listen to it for a minute. And same thing with respirations. So I'm going to listen to the apical pulse for 30 seconds. And again, if it's irregular, I'd listen for a minute. Same thing for the respiratory rate. So I'm going to monitor the respiratory rate. Okay, and then I'm going to listen to the blood pressure and make sure that the blood pressure is stable for their age and correct for their age. I would do the temperature, and then I'd also put them on the pulse oximetry. So now I'm going to assess the neurological status. So first that starts off with like me asking any questions like where are you, what's your name, how old are you, and if they're able to answer all the questions, then that's when I would document that they're alert and oriented ×4. I would assess the strength of the extremities and like motor coordination. So I would just make sure that if for strength, I would have them put their arms up like this, and I would have them I would pull on their arms while they bring them back to them, while they pull towards them, and then I'd push on. I'd have them put their hands up like this, and I'd push on their hands while they push back at me. I would do the same thing with their lower extremities. So I would push their legs. I would push their legs and they would push back at me, and I'd pull their legs and they'd pull back towards them. I could also have them move their neck side to side, move it in a circular motion, move their shoulders up and down just to make sure that they have range of motion here. I could also have them move their arms in a circle just to make sure that they have range of motion in their arms. And I can also make sure that they move their feet forward and backwards to make sure that they have full range of motion and their lower extremities as well. And then I would assess the 12 cranial nerves. So first I would start off with the integumentary system. So that would start off with me inspecting and palpating the head. So first I'm looking for texture, temperature, and moisture, and then I'd be looking for any blanching, any lesions, any redness, any edema, any scabs or anything like that. I'd be looking for make sure that there's no like drainage or pus or any lice. I'd be looking for after that I'd be looking at their capillary refill, and I'd be looking at their hands, like their nails and their toenails and their toes, and I would be doing the capillary refills on their hands and the capillary refills on their toes. And I would just make sure that it is no more than like 2 to 3 seconds. And then after that, I'd be assessing the eyes, ears, and the nose and the mouth. So for the eyes, let me grab my pen. So I'm going to be looking at the pupils and the alignment of the eyes. So the eyes are aligned to the pinna, to the top of the pinna, and their eyes are round and even bilaterally, and their pupils are about 2 to 3 diameters in size. I'm going to be checking their conjunctiva. So when I check on their conjunctiva, I'm going to be pulling down a little bit on the eyes and making sure that it's pink and moist. And then after that, I'd be looking at their pupillary reaction to light. So I'm just going to move my pen light like this and like this, and the pupils are reactive to light. I'm going to be checking for any extraocular eye movements. So I'm going to do the 6 cardinal fields of gaze, and I'm just going to have them look at my pen while I move it and make sure that they can just follow my pen. I'd also check for accommodation. So I would just have my pen here and I would move it towards the mid to their nose and make sure that their eyes are accommodating to it. I could also do the peripheral test, so that's when I would stand behind them. So I'm gonna have them stand here, and then I would move my hands up, and whenever they see my hands coming from behind them in their peripheral vision, they would let me know. And then I would also check for vision sight, so I would just have them look at the Snellen chart and tell me what's the lowest possible line that they can read to see what vision that they have. So then I would assess the ears. So I'm looking for any drainage or any pus, any redness. So I'd just be inspecting the ears. I'm also checking for like the alignment, making sure that they're both even bilaterally, which they are. I would pull back on the pinna and move it up. That way I can look inside and look at the ear canal and the tympanic membranes. And I'd pull back and up, and I'd look on that side as well. Obviously, I would be on the other side to get a better view. But yes, I would do that. And I'm also going to check for hearing. So in this case, I would have the client close their eyes, and they can stand in front of me, but usually I can also stand in front of them. But I would have them close their eyes, and I'm going to do the finger rub test. So I'm just going to go like this, and they will let me know when they can hear my fingers rubbing. So okay, and they let me know that they could hear it, so good job. Next I'm going to be inspecting the nose. So I'm going to be looking for any like drainage, any mucus, and not mucus, but I'd be looking for any drainage or and any drainage or redness. So I'm going to inspect the nose, and I'm going to look up with my pen light, and I'm just going to look up and make sure that the mucous membranes inside are pink and they're moist. And then I'm going to check for patency as well. So I'm just going to have them put their finger on one side of their nose and breathe in and out. And then I'm going to have them breathe in and out on the other side. So they do have patency. And next I'm going to check for smell. So I can have them close their eyes, and I could put something in front of them. So let's pretend that this is a vanilla candle, and I would just have them close their eyes and put it in front of them and ask them what they smell. If they tell me vanilla, then their cranial nerve 1 is intact. So now I'm going to be looking at the mouth. So I'm going to be looking at the lips first. Their lips are pink. I'm going to be looking at the oral mucosa. So I'm going to be looking inside the mouth. The oral mucosa is pink and moist. I'm going to be looking at the tongue, and the tongue is midline. So I'm going to also ask them to stick their tongue out and say ah. And the uvula rises with phonation. I can also have them stick their tongue out and make sure that they can move the tongue freely, which if I ask them to do that and they just did it, they can move it freely. And then I would make sure that there's no excessive drooling, and make sure I'm going to assess for swallowing. So that could consist of me coming behind them, and I'm going to put my hand on their, like by their throat. So in this case, it would be like right here. And then I would palpate on the other side with this hand. And then I would ask them to swallow. And then that's when I would feel them swallow, make sure that they're allowed to swallow, that they're able to swallow. And then I'm also going to look at their teeth. So I'm going to be looking at their teeth. There are no dental caries. Their teeth are intact. There's no cavities and no decay. So that is all intact, and it is appropriate for their age. They probably, if they're around 4 or 5, they probably have some missing teeth. They're starting to like lose teeth, maybe like 1 or 2 at most. But yeah, and then next I'm going to be assessing the respiratory system. So I'm going to count the respirations for 1 full minute, and I would do that right now. And then after that, I'm going to look at their overall chest configuration and the muscles that they're using to breathe. So their chest configuration is appropriate for their age, and they're not using any accessory muscles to breathe. So that is good. And I'm going to palpate them anteriorly and posteriorly, their lung fields. So this is a little bit harder to show on the pillow. And then I'd have them lean forward so that way I could do it on the back. And obviously it wouldn't be this low, it's just the pillow. But I would just ask them if they have any tenderness while I do that. And if they say no, that's really good. So then after that, I would listen to the lung sounds and all the lung fields. So I'm going to start off with the front. So I'm going to ask them to take a deep breath in and out for every time that I auscultate. And then I'm going to do it on the back. And while I'm auscultating, I am asking them to breathe in and out. Okay. So their lung sounds were clear, and there were no abnormalities noted. So now I'm going to assess for the cardiovascular system. So I'm going to be listening to the heart sounds and all the 5 cardiac points. So that would be the aortic valve, the pulmonary valve, and then the Erb's point, and then the tricuspid, and then the mitral valve. So I'm going to listen to all points. So, obviously I can't really show it on the pillow, but it would be the aortic valve, the pulmonary valve, and then the tricuspid and the mitral valve. And then I would palpate their carotid pulses. So I would do that one at a time. So I would check their their coronary artery pulses. I'm having a brain fart. But oops, sorry, I'm supposed to do it one at a time. So I'm doing this side, and then I'm doing this side, and then I'm checking for bruits. So I would auscultate, and usually I would use the belt of my stethoscope. So I would listen to that. Okay. And then next, I would be assessing the abdomen. So I'm going to ask the client to lay down for me. So first, I'm going to inspect the overall abdomen. And I'm going to be looking for any distensions and make sure that nothing is wrong with the abdomen. So I guess while I'm inspecting the abdomen, I can also inspect for any inguinal or any umbilical hernias while I'm at this step. And then after that, I would auscultate the abdomen in all 4 quadrants. So I would start off with the right lower quadrant, and then I'd go up to the right upper quadrant, and then go to the left upper quadrant, and then the right upper quadrant, the left lower quadrant. So I would do right upper, I would do right lower, right upper, and then left upper and left lower quadrant. After I've finished auscultating, I'm going to palpate the abdomen. I'm going to do it in that same pattern. So I'm going to palpate the right lower quadrant and the right upper quadrant, and then the left upper quadrant, and then the left lower quadrant. So after that, this is where I would look for that inguinal or those umbilical hernias. And then if there's none of that, then after that, I would sit them back up. And then from there, I'm going to inspect the genitourinary area. So I'm going to be looking for, in a female, I'd be looking for any vaginal or urethral discharge. And then for the male, I'd be looking for any urethral or penile discharge. And I'd be assessing the scrotum and whether they are circumcised or not. So next, I'm going to assess the musculoskeletal system. So with the musculoskeletal system, I'm going to be assessing the gait to make sure that it is appropriate for their age. So with that, I could just have them take a step towards me and take a step towards me, take a step back, and take a step to the left and to the right. I'd be assessing the extremities again and the strength and range of motion, and I would also assess the pulses in all extremities. So I think for the pulses in all extremities, I would do that in the cardiovascular assessment, but in this one, I'd be assessing the reflexes and the musculoskeletal assessment. So basically, for the after I've done the gait, for the strength and range of motion, what I would do is I would have them take a step. So that's after the gait. So for the range of motion and the extremities and the strength, I would just do that same thing where I have them put their arms up like this, and I would pull on their arms while they pull back towards them. Same thing with the push. I would have them, I would push on their hands while they push back at me. And then same thing for the lower extremities. I would push on their legs while they push back at me, and I would pull on their legs while they pull back towards them. Excuse me. And then after that, I would have them move like their shoulders up and down. I would have them turn their neck side to side, and in a circular motion, I would assess for crepitus. I would assess for crepitus. And then after that, I would assess for the reflexes. So again, I would assess the reflexes in the arms and the biceps and the triceps. I would assess the patellar and the plantar reflexes. And since I didn't assess for the pulses and the cardiovascular, I can assess for them in all the extremities and make sure that there's good blood flow in all of them. So that would just be the brachial, the radial, the femoral, and the pedal pulses, and the patellar pulses. So behind the patella. So after I've done that, I believe that ends the assessment. And I would just make sure, well, that ends the head to toe assessment. So now I would make sure that the client is comfortable, that they have everything within reach, their call light, and make sure that everything is within reach. I'd make sure that they're comfortable, and then let them know, like, if you have any questions for me, just let me know. And then I would open back up the curtain, wash my hands, ask them if they want it closed or not, and yeah, have a good day.